Why are my periods so unpredictable lately? Something just doesn't feel right. And why am I suddenly getting acne? And even extra hair growth?
Those symptoms might actually be connected by a very common hormonal condition called Polycystic Ovary Syndrome. Let's take a closer look at what PCOS really is and why it affects so many people. PCOS is one of the most common hormone conditions affecting women of reproductive age. PCOS happens when the body's hormone signals become slightly out of balance. Some people with PCOS have higher levels of hormones called androgens. When these hormones increase, the ovaries may have difficulty releasing eggs regularly. And when ovulation becomes irregular, menstrual cycles can become unpredictable. Another common feature of PCOS involves something called insulin resistance. This means the body has a harder time using insulin efficiently to move sugar from the bloodstream into the cells. As a result, the ovaries may develop many small follicles. These are tiny fluid-filled sacs that can be seen on ultrasound. This appearance is where the name polycystic ovaries comes from. Doctors commonly diagnose PCOS using something called the Rotterdam criteria. The first feature doctors look for is signs of excess androgens. This may include acne, increased facial or body hair, or elevated hormone levels on blood tests. The second feature is ovulatory dysfunction, meaning irregular or absent menstrual cycles. And the third feature is polycystic ovaries on ultrasound, or certain hormone patterns in blood tests. Doctors usually diagnose PCOS when two of these three features are present. Symptoms of PCOS can vary widely from person to person. Common symptoms include irregular periods, acne, increased hair growth, or thinning hair on the scalp. PCOS can also affect metabolism, increasing the risk of insulin resistance, weight gain, and type 2 diabetes. It may also affect emotional health, with some people experiencing anxiety, depression, or sleep problems. The good news is that PCOS is very manageable with the right care. Healthy lifestyle habits like balanced nutrition and regular physical activity are an important foundation for everyone with PCOS. For people with irregular cycles or hormone symptoms, doctors often prescribe birth control pills to help regulate hormones. Medications such as metformin can also help improve insulin resistance and support metabolic health. And for people trying to become pregnant, medications like letrozole and Clomid can help stimulate ovulation. The most important thing to remember, effective treatments are available. With the right medical care, support, and knowledge, people with PCOS can live healthy lives. Be encouraged. With diet and exercise, many women are able to achieve their goals.